Hi, I'm Corey Goldberg. Welcome to our December newsletter. And this month we are calling it Best Face Forward because we are featuring facelifts. Last month we featured phenol croton oil peels, which are a really great way of addressing the canvas of the face, the skin, and rejuvenating and reversing sun damage. While a facelift is really powerful at restoring structure, lifting things that have descended, putting volume back in places where we've had deflation. And the two techniques, treating the skin and the surface and then the structure of the face, are actually complementary. And I often do them together or in a staged fashion. I just got back from a conference of the Canadian Society of Aesthetic Plastic Surgeons in Montreal, where I presented a case that I did doing a combination of a phenol croton oil peel followed a few months later by a facelift, and got a lot of very good feedback from the other surgeons at the conference about the presentation. A lot of interest in learning how to do phenol peels. So I may do another course in September, again next year in Toronto. This month we're featuring facelifts, and I often get asked first, how long do they last for? And I usually tell patients to expect that a facelift will last for about 10 to 15 years, at which point, even though there will still be a benefit from having had the facelift, there will be ongoing aging, and at that point, 10 to 15 years later, it might be time to think about doing the same procedure a second time if someone wants to maintain that appearance. It's important to note that facelifts are meant to have a natural appearance, that it's meant to restore a rejuvenated look, not to make the face look pulled. Usually an overdone pulled face is either a poor technique or too many operations exceeding what someone actually needs to be done. Following a facelift, I usually tell patients to expect about 3 to 5 days of downtime at home, and probably about 7 to 10 days before someone can go back to public or social activities, and reasonably, not have anyone recognize that something has been done. I am excited this month in December to be traveling down to San Francisco, where I'm going to be spending a day in the operating room with the world famous facial plastic surgeon, Dr. Tim Martin, whose specialty is facelifts, and I'm looking to add some extra tools to my facelift toolbox. I'm also going to be attending the Buck Institute on Aging Center for Healthy Longevity Roundtable for Longevity Clinics. And I hope to bring back some really interesting longevity tools from that as well. Right now, the practice is quite busy. Our operating rooms are full and booked into February, and in fact, we've added several extra OR days. So if you are thinking about winter surgery, I'd be happy to hear from you and get you set up. Time is booking quickly. In the meantime, I wish you a happy December, all the best over the holiday season, and I will check in with you again in January.